Tulare, California, population 60,000, is a small town just 45 minutes southeast of Fresno. With more than half the population served by Medi-Cal, pickings can be slim when it comes to healthcare. That's why the local hospital, Tulare Regional Medical Center, became ground zero in the fight over medical staff independence, led by CMA member physicians dedicated to working in this underserved community.
Tulare litigation started on January 26, 2016, when the chief of staff sent me a letter that all of the physicians had received the previous night from the hospital's board chairman. And the letter was very simple and terse. It said that the hospital was terminating the medical staff and its physician leaders and its bylaws, and in that place was recognizing a replacement medical staff that had its own different set of bylaws and its own different set of physician leaders.
The Tulare case was not just about one hospital medical staff that was being wrongly treated by its governance structure. It's about every medical staff. It's about the autonomy of physicians to make medical decisions and the clear division of power between a governing body, which is administrative, and the medical staff, and making sure that that separation of powers and duties and responsibilities stayed in place was important for Tulare and every medical staff in California and frankly in the nation.
Medical staff is there to oversee the quality of care provided to patients in the hospital. That role is not designated to the CEO of the hospital or the board members.
The action was taken was illegal and is unprecedented.
First, we could not believe it. That's when we asked our attorney, that's when we called Long Do from CMA.
CMA got onto this case extremely early, and in fact this case moved quickly in large part because we were there to help the medical staff and then to seek outside resources and help in getting this resolved.
We knew immediately, based on that letter, that this was a very serious situation and a very serious incursion on medical staff rights and self-governance. So CMA got engaged immediately. We sent multiple letters to the hospital board, to the California Hospital Association, and to a number of other stakeholders explaining that what the hospital was doing was a blatant violation of very clear law in California that requires hospitals to honor a medical staff's independence and self-governance. CMA was involved from the very beginning in that lawsuit. We worked with the medical staff's attorneys. We filed an amicus brief at the very beginning of the case. When it became clear that some additional attorneys were needed to take on the hospital, which had loaded up their defense with 3 different law firms, 3 different sets of lawyers, we learned pretty quickly that the medical staff also needed to strengthen its legal team. And so CMA reached out to our contacts and found a very good top-notch litigation boutique firm to represent the medical staff along with its regular attorneys.
We went and reached out to medical staffs. We went and reached out to the members of the medical staff at Tulare, all of their colleagues around the state, to support them financially. We reached into our coffers in order to help support them financially. And most importantly, we reached out to the litigation center at the AMA and were able to reach to them to show how important this was. They then reached into their much deeper pockets and in large part made the entire defense and moving forward possible. Absent those monetary resources and our internal legal help, I don't know that we would have had the outcome that was necessary before the whole thing collapsed for lack of resources.
The local medical society and the physicians and the medical staff, in conjunction with the California Medical Association, asked me to initiate the case, which we did by bringing an ex parte application to reinstate the medical staff. And we certainly couldn't have done this without the help of the California Medical Association.
The narrative when the case started was that this was a group of troublemaking doctors who were making it impossible for the hospital to run as an efficient hospital. And one of the things we had to do is dispel that notion. We, instead of being on the defense, went on the offense.
Before closing arguments were able to be held, the hospital, Tulare Regional Medical Center, abruptly filed bankruptcy.
It was very devastating for the community to have the hospital close, but They knew that they had to wipe out all the previous administration, the board.
Dismissal of the medical staff affected the community in a significant way. Since the hospital is closed, they have to go to another hospital and wait 10 to 15 hours to be seen.
The lawsuit really enabled the medical staff to get its story out to the community, and the community then changed the leadership, which enabled us to get the relief we wanted through a stipulated judgment.
The court accepted the stipulated judgment, which finally brings an end to the troubles at Tulare Regional Medical Center and allows the medical staff to rejoin the hospital and help get the hospital back up and running.
The importance of this case is it's an example of what will happen to a hospital and the hospital's leadership when it decides to trample the rights of the medical staff.
If we didn't have CMA support, we couldn't have won this lawsuit.
None of this could have been done unless the CMA and the AMA had funded this lawsuit. That enabled the medical staff to stand up to a large and well-funded organization.
This was a case involving 125 doctors. There's no possible way they could have afforded to prosecute the case themselves. And it's only by the collective action of organized medicine through the California Medical Association that this was possible.
I learned significantly a lot what CMA means. It's not only just an organization, it's also a partner.
My message to our fellow medical staff is, or fellow physician is, always join your local medical society, join CMA, AMA, because you never know when you need help, because those are the people who come to your rescue.
Be involved, be part of CMA, learn about the organization, because you never know, you might be next.
The litigation fund that is housed in the Center for Legal Affairs is the bloodline of our work. Without the financial support from medical staffs and individual physicians, CMA would not be able to advocate for doctors.
This case represents a great result in that doctors can take comfort that when their rights get trampled and their autonomy, self-governance is questioned, they have a remedy. And this case is in a small town here in Tulare County. However, it has ramifications statewide, if not countrywide.